Deadly fungus is spreading, hitting Nevada hospitals hard. Health officials are labeling it a superbug because it is difficult to control. And it's an outbreak, experts tell Fox 5's Drew Andre they were waiting for. He joins us live now with more details. Drew?
Well, John, this fungus is exclusively found in hospitals, so it's not something that spreads in the general public. But history shows us that this fungus is deadly and can spread rapidly through healthcare settings. Hospitals can be a breeding ground for spread of disease, and a deadly yeast fungus called Candida auris is lurking through Nevada hospitals.
This is a disease we've been looking for a while. We knew that it was out there. There was always the potential that we would see it in healthcare settings. And over the past few months, that's what we've seen.
It attacks the most vulnerable, which is why it pops up in hospitals.
Those who have catheters, breathing assistance, things that basically break the skin and make it easier for bacteria and fungal infections to get in. And that's what happens in this case.
It can wreak havoc throughout the body, causing serious infections. And they're hard to treat because it's resistant to most antifungal drugs. And symptoms are hard to detect because it's often infecting people who are already sick.
Once it gets into the hospital systems, it's challenging to control.
Infectious disease expert Brian Labus says once the fungus finds its way into hospitals, the only way to control it is by screening and testing new patients and to put a big emphasis on hand washing.
It comes from a provider coming in and touching a patient with the disease and then carrying it to the next one. It comes from contact between patients, and it can come from surfaces. It's not something that's spreading through the air.
Labus says about a third of patients die from the superbug, but so far the death rate here in Nevada has been lower than that. And Labus says the reason the death rate has been lower is because there's been a lot more testing at hospitals for this superbug, so they're catching it before more symptoms arise. John?
Drew, thank you. And we did reach out to the Nevada Department of Health and Human Services for exact numbers, and we'll bring you that information as soon as we get it.